Awesome. So thanks again, Dr. Horowitz, for taking the time to speak with me today. We are going to be discussing the use of double dapsone to treat Lyme disease and other tick-borne diseases. So in order to introduce the dapsone in general, can you explain what exactly it is?
Sure. So dapsone is an antibiotic. It's a sulfa drug. And the beauty of it is that the drug has several properties that make it extremely useful for treating Lyme patients. So first of all, it's anti-inflammatory, which we need in Lyme because the reason Lyme patients get sick in general is from inflammatory cytokines, from inflammation in the body. That's what ultimately causes fatigue, headaches, joint pain, muscle pain, brain fog is inflammation. So that's the first great quality of the drug is it's anti-inflammatory. The second is it hits persisters. So we learned 5, 6, 7 years ago that it wasn't so much that Lyme persisted in the body. Those of us who've been doing this for a long time knew that, but rather that it was a persister bacteria, which the minute I heard that from researchers at Johns Hopkins and other universities was, oh, you mean it's like tuberculosis, like leprosy. So they've used dapsone for 50, 60 years for treating leprosy. It was used with rifampin, and they would usually give a year of rifampin and dapsone for people with leprosy. So when I looked at the drug and knew that it was anti-inflammatory, had persister properties, I thought, well, gee, that would be interesting if I added doxycycline to the mix because doxy hits Ehrlichia, Anaplasma, Lyme, Mycoplasma, Chlamydia, tularemia, right? All of these other infections that patients get. The third quality of the drug that was great is it has excellent penetration into the central nervous system. So since I've been starting to use dapsone, I've almost never had to use any IV drugs anymore. The only time I've had to use an IV in the last couple of years is if someone had an EM rash with a Bell's palsy and was failing, for example, high-dose doxycycline at 200 milligrams twice a day. And the fourth property that makes it useful is also that it has effects against immunity. So in other words, for people who have autoimmune reactions, which is what we see with Lyme all the time, it is useful. So for example, in Behçet's disease, which is a severe autoimmune illness, dapsone has been used for many, in fact, for decades, they've been using it and not really knowing truthfully why it works. And Dr. Freeman and I published a study, I think it was about 5 or 6 years ago, on a patient with Lyme and Behçet's. And we discovered that when we gave this patient doxycycline, rifampin, and dapsone, which is part of the double dose dapsone combination therapy, and we added pyrazinamide, we found that it worked quite well for Behçet's. In fact, it was the first drug regimen that made her Behçet's go away. And her Bartonella relapsed. In other words, she had negative Bartonella titers and a negative VEGF. All of a sudden, we give this intracellular combo and it wakes up Bartonella, and it woke up tularemia by going inside the intracellular compartment, and it woke up her HHV6, which reactivated. So it's a really interesting drug combo. And actually, there's even a fifth action of the drug, which is anti-malarial. It's not enough to completely kill Babesia, but just like with other sulfa drugs, whether it's Bactrim or even disulfiram, which has an effect against Babesia, it is useful because it does tend to help to lower the load of that particular parasite.
So you went on to describe some of the benefits and how you may use it in a combination therapy, but could you describe a little bit why you prescribe a quote unquote double dose?
So when I started to use dapsone years ago, and I discovered that it had some effects, I would give it to patients at the usual dose that we were using for leprosy, which was 100 milligrams per day. And if you know a little bit about my medical career, you know that some of the discoveries I've made, and not just myself, probably other scientists and people in the field, a lot of it is by accident. So for example, one of my patients, who is this young 27-year-old male, was in bed for years with a chronic fatiguing musculoskeletal neuropsychiatric illness, right? Things we see with Lyme, couldn't go to school, couldn't get a job, couldn't hold a job. And he was on dapsone and he was going into his 4th month. He was on doxycycline, rifampin, dapsone, which is the dapsone combination therapy. It's always used with Plaquenil, hydroxychloroquine, because it alkalizes the intracellular compartment. Plaquenil also is very useful for the cystic forms or round body forms of Lyme disease. So, we always use it with that and nystatin to keep down yeast. But in his 4th month, he accidentally made a mistake and he used dapsone at 100 milligrams twice a day. And this was probably 5 years ago or so. He did this. He came into my office and he said, "Doc, I'm feeling terrible." And I said, oh, what's going on? He said, I've got horrible fatigue and headaches and brain fog. I said, oh, what are you taking? He said, well, Doxy, Rifampin, Dapsone twice a day. I went, oh God, you're taking too much Dapsone. Stop the drug, get off of it, come back in a month. Let me see how you're doing. And he comes back in a month and he says, I feel great. Now, pretty much all of his symptoms had gone away at that point, except for small fiber neuropathy. He did have small fiber neuropathy on a prior biopsy. He was about 85% normal, but all his regular Lyme symptoms had gone away. I said, listen, let's not do anything. Let's just follow you. And he would come in every 3 months. And he stayed stable for a year or longer until he got something like 16 or 17 tick bites going to Maine. That's a whole nother story. Prevention, folks out there who are listening to this.
Yes.
Permethrin, picaridin sprays, please start to use them. So in any case, he ended up doing very well until he got the tick bites. So I turned to my wife, who had been sick with Lyme for 25, 30 years. And I said, honey, would you like to be a science experiment and a guinea pig for me? And because she loved Dapsone. Every time she went on 50 milligrams, she felt better, would relapse off. She went on 100 milligrams, would feel great. She would relapse off. So I put her on this 8-week protocol with double dose Dapsone, and she's been 3.5 years now in remission without ever having a Lyme symptom come back. So we published the studies a couple of years back. It was about 2 years back now at the end of 2020 on double dose Dapsone combination therapy, and also a culture study showing that Dapsone in culture had an effect on these Lyme persisters, because, I do everything backwards. First, I figure out clinically if the regimen works, and then I go into culture and go, does it actually work on persisters? And fortunately, it did. It would probably have made me look foolish a little bit if it didn't, but it did. So in any case, we proved it in that study. It was only about 40 patients in the published study, but I've used it now in hundreds and hundreds of patients.
So I heard you mention that one individual who had accidentally taken a double dose, he had a lot of these side effects. Are those noticeable side effects of the drug, or was that more of like his Herx reaction and his body trying to heal itself?
It was a Herx reaction, and I can just explain briefly the side effects of Dapsone. And I think a lot of people who are concerned about taking the drug, they really don't have to be. At this point, I've easily used this drug in 1,000 people. And, so I describe the side effects of Dapsone as do no harm, HARM. So H is Herx's. So anytime you use a drug that is a persister drug like Dapsone or disulfiram, and in my opinion, the advantage, by the way, of using Dapsone over disulfiram is the half-life of Dapsone is only 24 to 28 hours. So if you get a Herx from Dapsone, or if you get methemoglobinemia, which I'll describe in a second as a side effect, when you stop the drug, it's out of your system pretty quickly. Whereas disulfiram, it's in your body for 14 days. It's a half-life of 14 days. So it's actually in your body for about a month when you take this drug. So in his particular case, it was a Herx, which is inflammatory cytokine release. And interestingly enough, we've learned how to block cytokines over the years. And, there are several inflammatory pathways, and I tell this to patients all the time. One is NF-kappa B. It's one of the same pathways we see in COVID-19. You block it with N-acetylcysteine, 600 milligrams twice a day, alpha lipoic acid, 300 to 600 milligrams twice a day, and glutathione, 500 twice a day. But in Herx's, we usually use 2,000 milligrams at a time. So when we block NF-kappa B, and we stimulate NRF2, which is another pathway that lowers inflammatory cytokines, using curcumin, 1,000 milligrams twice a day, broccoli seed extract, sulforaphane glucosinolate, 100 milligrams twice a day. Melatonin blocks a pathway called NLRP3 inflammasomes. We can keep down the Herx's when we alkalize the body, use a lot of glutathione, detox the body. So that's not really the problem with Dapsone. But the interesting part about the drug is, if someone has never taken a persister drug like Dapsone, we found out over the years that most of the inflammation that Lyme patients are getting are from these persisters that are in biofilms. And the reason we know is that Hopkins did a study years ago in the mouse model, where they showed that the amount of inflammatory cytokine release when they were using these persister drugs was absolutely enormous. So, we know that that's the main source. I used to think it was cystic forms or other forms of Lyme, but it really is the biofilm and persister forms. And in some patients that have never even taken a persister drug, if you give them a biofilm agent, a biofilm disruptor like stevia, biocidin, cinnamon, clove, oregano oil, peppermint oil, essential oils, even without giving them persister drugs, if they've never taken a sulfa drug, dapsone, disulfiram, you will sometimes see tremendous herxes because you're opening up the biofilms and the immune system is recognizing these persisters. So this is really one of the main forms of why Lyme patients get sick. So the first side effect is herxes. The second is anemia. Dapsone interferes with folic acid metabolism. The way you reverse this is just by giving very high dose folic acid. So we use a combination of leucovorin, which you get from the pharmacy. At double dose dapsone, I would say in general, when we published the study, we were giving probably around 75 milligrams. They come in 5, 10, 15, 25 milligrams. We give 25 of leucovorin. At this point, I would say we probably even give 2 twice a day when people do double dose dapsone. So they're on around 100 of leucovorin. You want to make sure your insurance covers it because it's expensive. And we use L-methylfolate, which is a more potent form of folic acid. It's a methylated form. And I'll even use up to 60 milligrams. So we use up to 160 milligrams of folic acid. So you can see 3 to 4 gram hemoglobin drops. So the only place you want to be careful if you're starting dapsone combination therapy and you're a woman, you would like your hemoglobin theoretically at least 12. Right, the lower end of normal, because you could drop to around 8. When my wife did double dose dapsone combination therapy, she was at about 8.6. But the reason people tolerate it, even when they get to that level of anemia, and it reverses, by the way, fairly rapidly off the drug, within 1 to 2 months off the drug, you'll be back to where you were, sometimes even higher, is because, again, the drug's out of your system pretty fast. You just want to make sure that you don't have overlapping iron deficiency, B12 deficiency, apart from the folic acid you're giving. And we have seen occasionally a person with, for example, a high methylmalonic acid, which is a marker for occult B12 deficiency, who the anemia was not reversing as quickly as we liked. And we found out it was because she had occult B12 deficiency, even though her B12 levels were normal. So as a woman, before you start this, you want to make sure your iron levels are good. You know, you've maximized where your hemoglobin and hematocrit are. But really, it's a very doable, even if you've got it around 12. And even in the high 11s, you may not even go a 4 gram drop, but it, again, very tolerable. So HAR is rashes. Rashes are only seen with dapsone if you have a severe sulfur sensitivity. And the beauty of the drug is, even if you're a sulfur allergic patient, you have an allergy to Bactrim, to trimethoprim sulfamethoxazole. The dapsone has probably about a 1% chance of causing a rash, as opposed to someone who's got, you know, a rash with a sulfur drug where it's going to happen like 100%. And it's 3 times more frequently, by the way, with disulfiram. Disulfiram is also a sulfur drug. We see many more rashes with disulfiram that we see with dapsone. I can't even remember the last rash I had from someone who had a sulfur allergy. And if you suspect a sulfur allergy, but a mild one, you can not only go to an allergist and get checked for sulfur allergies, but if you don't have a really severe allergy, like I'm talking like skin shedding, when you get Stevens-Johnson, and I've never seen a case in my lifetime, you can use an H1, H2 blocker like Zyrtec and Pepcid, which blocks histamine reactions. Histamine 1 receptor is histamine 2, and you give it to people and they start like on a tiny dose of dapsone, like 25 milligrams, to test the waters. So you give them a 25 milligram dose with an H1, H2 blocker like Zyrtec, Pepcid, and almost everyone will say, I get no rash, I have no itching, I'm fine. The last and the most severe reaction, but which we've learned to control, do no harm, HARM, M stands for methemoglobinemia, right? So methemoglobin is when you're not carrying oxygen as efficiently on the hemoglobin in your blood. So this means that people, when they take double dose dapsone, they may get blue hands, blue lips, some shortness of breath, more severe fatigue, headaches. So in general, the levels of, when you're on double dose dapsone, before I knew about getting methylene blue compounded, we would use high dose glutathione. For example, my wife, when she did double dose dapsone, didn't even use methylene blue. It wasn't available. So she used, for example, 2,000 milligrams of glutathione twice a day, and her methemoglobin level stayed at around 4 or 5%. She was fine. But some people will get methemoglobin levels of 7%, 8%, 10%, 12%. Now, life-threatening methemoglobin is 55, 60%. It's never even gone close to there on anyone who has ever taken double-dose dapsone combination therapy. And there's a new study that I will be publishing. I'm starting now to take a look at the charts. Just like the patient who did double dose dapsone and made a mistake, one of my recent patients took quadruple dapsone for 4 days. She was sick for 15 years. She got a letter from her husband going into the second month where he said, I want to divorce you. She got so upset. She messed up the dose, called me on a Sunday. She was on her 4th day of quadruple dapsone, 200 twice a day, and said, Doc, I'm feeling horrible. Same story. What are you taking? Oh, I'm taking dapsone 200 twice a day. Oh, it's too much. Stop the drug. Same exact, thing. She's now 1 year in remission. She never even got into the second month of double dose dapsone. She only did 4 days at this quadruple dose. So I took a group of 40 patients, 45 patients who were resistant. Either they did double dose dapsone and failed it, primarily because they had active Bartonella. Bartonella is the main bacteria that is causing resistance to this regimen. Babesia is a 50-50 shot, but the efficacy of double dose dapsone regimen is about 50%. Disulfiram, it's around 36, 37%, but you need disulfiram for 6 to 18 months when you do this protocol to get that kind of efficacy. And as you go up on the dosage, 2/3 get severe fatigue. A significant amount get psychiatric issues. 25% get bad neuropathy. So dapsone helps neuropathy, right? It doesn't cause neuropathy. It actually helps neuropathy. And a lot of these patients, I did this quadruple dapsone for 4 days, were on low dose disulfiram. The other thing for the Lyme community, I think that's going to be really interesting to do studies in the future is combining dapsone and low dose disulfiram, because what we're finding is 2 persister drugs are better than 1. And I expect that hygromycin A and azelocillin, which are drugs that, should be coming out soon from Ken Lewis's lab in Stanford, those will hopefully be available in the next year or two. We'll have, other things in our arsenal. But just know that when you use for methemoglobin high-dose glutathione and compounded methylene blue, 50 milligrams twice a day, it basically keeps the methemoglobin levels at 5% or less. And if it goes higher, you take more glutathione, you take more methylene blue. Sometimes you can use vitamin C high dose. Some people use Tagamet. There's things you can do, but honestly, it's very manageable. No one has ever had a life-threatening reaction from it. And honestly, considering that you could go on and suffer from chronic Lyme for your entire lifetime if you don't hit these persisters. For me, this is the answer that the Lyme community has been looking for all these years. I now have a large number of people in long-term remission for 1 year or longer after doing double dose combination therapy, and they were sick for 10 years, 20 years, 30 years. But the trick is you have to have all of the variables on the MSIDS model controlled. So for example, if you have active Babesia or BART, you got to treat it before doing double dose dapsone. If you have low adrenal function, low testosterone, treat it before doing double dose dapsone. If you have POTS dysautonomia, treat it. In other words, you go into a doctor's office with 16 nails in your foot, you got to pull out all the nails. Otherwise, you're not going to see the full effect from double dose dapsone combination therapy.
No, that makes a lot of sense. And I appreciate your description of the efficacy. That was going to be one of my questions. It seems like at 50%, in that 50% of people that you've seen efficacy, there's legitimate long-term remission that you're achieving, which is definitely very exciting. My final question, at least directly related to dapsone, is what results or have you seen like a wider acceptance of this drug for treating Lyme in the community and other professionals in your field?
So, I do a training for healthcare practitioners once a year. It used to be in person, but obviously since COVID, it's been more Zoom. And I've trained at this point over 200 healthcare practitioners, and I always go through this dapsone combination therapy in detail. And every year I keep updating my slide deck because every year there's new things coming out. So, the great part is because I've trained over 200 healthcare practitioners, anyone listening to this interview that, for example, lives in another state than New York and can get to our office, we still accept, a small flow of patients that come into our practice, but it's only John Fallon and myself. We can get you some of the names of these other doctors we've trained who do double dose dapsone combination therapy, because I've really gone through this protocol in detail, holding their hands, explaining the side effects. And pretty much every week or two, a doctor will call me up and ask me a question. I get on the phone and, I'll answer questions about the protocol. So there has been a greater acceptance, but ultimately what we need, and this is where I'm really suggesting the Lyme community comes together, we need a randomized controlled trial, right? So, I've applied to the foundations before, but it's a couple of $1 million if you do it really the right way. I'm hoping maybe by the end of this year, I'm in the middle of now trying to work out a randomized trial on long haulers at the University of California, Irvine, looking at the 16-point MSIDS model and glutathione deficiency, which is the model, of course, we've used for Lyme. That's in both of my books, Why Can't I Get Better and How Can I Get Better? So I need that randomized trial out of the way, but I'm thinking a lot of these docs that I trained in this program we do once a year, they might be willing to just enroll patients through their practice and do it, but they're going to need to be paid, right? It's not like I need a lot of money myself to do this, but the docs who enroll, it takes a lot of time and effort to fill out the forms and do this correctly, get an IRB involved. It's the only way, honestly, that the Lyme community and the broader community, including, by the way, the NIH, the CDC, and the rest, is going to be convinced. Because right now, if you look at the third tick-borne working group, right, I was on the first round of the HHS tick-borne working group. We still have members on the working group that come out, like Dr. Dixon and Dr. Sood, who will say, oh, Lyme is not a persistent infection. And it's like, excuse me, folks, when, President Obama, put together this program for, these 2-year cycles of this, if we don't have a solution by the end of this third round, and part of the thing that I've suggested to the group is to invest money, it's $250,000 or $500,000 for every question you ask, but there is a way to get HHS to do a literature search on, is Lyme persistent, right? That would go a long way, right, to solving this problem, because otherwise it's the old idea, say I lads, back and forth. So I think, if we got the money for HHS to do the medical literature review and we got a randomized trial on Dapsone, definitely that's the answer. But now that I see the quadruple Dapsone having some efficacy, and by the way, these are 8-day pulse protocols. So I want to be clear that I'll have gone through these charts in the next month. We got a journal who wants us to submit. So I kind of have to put my pedal to the metal now. I've got about 45 charts to go through, and some are like a lot of volumes. I need to go through these charts because I think about half of them were Bartonella fish positive who failed initially the Dapsone protocol. And I used to say to myself, Dapsone's not really going to do it for BART. But now what I'm not sure is some of these patients who did the higher dose Dapsone, we know that Bartonella is a persister bacteria also. It did help. And some of them, it was like every time they did these 8-day pulses, layers of the illness came off. So, someone, for example, who's anemic, as we were talking about earlier from Dapsone, another study we really need to do in a randomized trial, if this pans out once I look at the charts, and I think it is going to pan out, is 8-day pulses of this protocol, maybe once a month. No more longer-term antibiotics for Lyme patients, right? 8 days of a pulse, stop it for 3 weeks. 8 days of a pulse. What you do is you go in there and you keep knocking down the persisters, but this will decrease the effect on the microbiome. You're not going to get a lot of anemia if you're only on Dapsone for 8 days. It's going to really make a big difference, but the methemoglobin levels will go higher at higher doses. So you are going to need a touch more methylene blue and glutathione, but again, it's manageable. So, I feel like the universe is giving me answers and I'm getting really, really close. But I could use the Lyme community support in getting these kind of trials out there because I'm only one guy. I'm getting old, folks. I hope to live another 60 years. I'll make it hopefully to 120. But assuming I don't, you want to kind of use my good health right now and my energy and vim and vigor to help you to get these trials out there, because I really see that we're coming close to a durable solution that we've never had before for the Lyme community. So this is really a reason for hope for all of those people out there that are suffering.
Yeah, it definitely sounds extremely exciting and promising. What you mentioned about the tick-borne disease working group and the lack thereof of acceptance of persistent Lyme disease just blows me away, because we have a whole section of our website called Lyme Persists that takes studies from like Johns Hopkins, Stanford, Harvard, that all showcase how and why Lyme persists. So it's just crazy that there's still resistance to that fact in the higher levels of government. But I think that, given everything that you've said, it seems that there should be a lot of support within the Lyme community to help you achieve these trials that would be promising to find, like you said, a solution that has been eluding the entire community for years. So thank you so much for covering everything on double dapsone. I did have a question on a personal note. I know that you have a book coming out soon. Could you explain the concept and purpose behind Starseed? Is it revolution or revolution?
No, it's revolution. It's R/evolution. The idea was to have a double entendre, a double meaning, right? That it's Starseed revolution, but also evolution, right? As an evolution of consciousness. Sure. So about 4 years ago, kids were coming into my office after getting over Lyme. They had actually done dapsone combination therapy. They were getting over Lyme. They felt great. And I said, well, what are you going to do with your life? And they said, nothing. And I went, what do you mean nothing? Like, you're going to school, going to get a job? No. Why not? Well, the world's going to end. Why should I go get a job or go to college? I thought, okay. So, when the universe, I don't know how everyone deals with the law of synchronicity, but when I have synchronous events, like kids coming into my office every day, every week with the same story, and this was happening 4 years ago, where they were constantly coming in with climate grief. And the New York Times about 2 weeks ago actually published a nice opinion piece on this, that over 50%, I think it was actually almost 2/3 of kids and adults now are suffering from climate grief because they're seeing that our, humanity is actually jeopardizing our future because of what's now happening with our climate emergency. I decided in 2018 to dive into the climate literature to see what these kids actually were seeing and feeling. And when I dove into the climate science, I realized that they were right. We were in big trouble. Now, remember, this is a time when our administration was denying climate change. You could not even say climate change in the year 2018 with the US government. So I decided to write a book, and I kind of went into meditation because, I've been studying with my Tibetan Buddhist teachers now for 40 years. And I prayed, I went into prayer and meditation, and I said, what do you want me to do for these kids who have climate grief? And how do you want me to help the world, right? What can I do? And I heard in my meditation, write a book. To which I responded in my meditation, why would anybody want to read a book on the climate by a Lyme doctor? To which I heard in meditation, no, not just any book. We want you to write a science fiction climate change book. To which I responded again in meditation, you want me to do what? And I heard yes, and make it funny. So you understand, I've been meditating for a long time, and I don't usually hear these type of things in meditation. And I sat down and I opened and I downloaded a 450-page manuscript over about 6 months. I just kind of looked at a blank screen, listened very carefully for character names. I had no idea what the story was going to be, except that one of my next door neighbors, Margaret Donor, had written some Starseed books. And I loved the idea, kind of the Orion Wars and the reptilian invasion. I said, I could riff off that. And I wrote the book, and I also wrote it because for anyone who's been in Lyme for this long, that when the CDC described that we had 500,000 cases of Lyme last year, the year after year after year, tick-borne's getting worse. Why is tick-borne disease getting worse every year? It's from the climate. What we've shown is that as the planet is heating up, these insects, their reproductive rates is directly related to environmental temperatures. They have no way of regulating their internal body temperatures. So mosquitoes, ticks, and fleas, they're all getting worse as the climate is heating up, which means more vector-borne disease, more malaria, more dengue fever, more Zika virus, but also more Lyme and tick-borne. So the climate is playing a direct role on the spreading of Lyme and tick-borne. When we get these wildfires, we're actually changing the tick population. So for example, in California, when they had wildfires and they looked years later at what happened to the tick population, it went from 100% Ixodes ticks to like 55% Ixodes, 45% Dermatocentrum, which means now rickettsial infections were now going to be on the rise. And even though Lyme can kill, I mean, I think it disables more than it kills, but it can kill people through Lyme carditis and the rest. Rickettsial infections can kill. Rocky Mountain spotted fever, you could be dead within 7 days if you don't get doxycycline into your system. So, climate change is having an effect on that. My patients with Lyme are all coming in with not only heavy metal toxins, but mold toxins. And as we're getting flooding from these hurricanes, at least 75, 80% are now coming in with high levels of mold toxins. So that's starting to affect my Lyme patients. And, so when I wrote this book, I said, people are in general don't want to read a hard science book about the climate because it's kind of boring. And it's like bad news bears. So this book, Starseed Revolution, it was released about 2 weeks ago. And we're getting very good reviews from people who've read the book, but it not only describes the problems, but also the solutions for the climate. There's a climate summit in the book. You'll read about solutions. Just as what I've been trying to do for the Lyme community for years is to give them hope, but hope really based on hard science, just as we discussed with Double Dose. Starseed Revolution, The Awakening, is also novel solutions for our climate. And right now, quite truthfully, just so people are aware, we're in the early stages of our 6th extinction. The UN biological diversity is letting us know that by the year 2050, 25 to 33% of all species on this planet are going to be extinct. We're losing 150 species a day. A lot of these are pollinators. The bee populations are going down in a lot of the US states. If we lose pollinators, we're going to lose the food supply. The food supply is already being affected from droughts and from flooding. So, there are solutions, and I have a 5-part solution: regenerative agriculture, which keeps carbon in the soil, all right, and help with our food supply, electrifying everything with wind, wireless, solar, looking at preserving 50% of the land and oceans, which we need to do at this point because of the loss of biodiversity, geoengineering the Arctic. In about 3 to 5 years, the Thwaites Glacier in West Antarctica looks like the ice shelf is going to crack and break off. That glacier may raise sea levels by 2 to 3 feet within the next 3 to 5 years, which means New York City, Boston, Miami, and all global cities on the coast will be underwater. So we're talking a national security risk for our country, for all countries, right? This is the biggest threat, existential threat humanity has ever faced. So this book is my attention, is a way of bringing attention to it, but also bringing novel solutions, including geoengineering the Arctic, with ways of like what volcanoes have done before for cooling the Arctic, with cloud brightening, with solar panel. There's many ways I have in the book about doing this. So there's solutions, and I'm trying to get the word out for people that there are solutions. There is hope for the climate also, but the window of opportunity is closing very quickly. And my call to action for the Lyme community, because there are millions of people, right, involved in this community, is that the climate is making Lyme worse. It's making the toxins worse that are getting into your body. But for you now and your children and their children, this is the greatest threat we have ever faced. And the Lyme community is a force to be dealt with, and they've never really come together in a really good way. And this is an opportunity to make a difference, to come together and to see what you can do for the climate, because it is the greatest challenge we've ever faced. Even COVID-19, we're getting over the pandemic. As the permafrost in the Arctic is melting, there's bacteria, viruses, and fungi in that permafrost, which is no longer permanently frozen, which is a risk for new pandemics going forward. There's a lot of reasons why the Lyme community should come together. And, my book, by the way, also has a lot of Lyme jokes. For those of you who need a laugh after 2.5 years of COVID, I promise you the Lyme humor and the Lyme jokes poking fun at governmental institutions and everybody needs a laugh. Everyone who's read this has basically told me it's hysterical that, they thought I did a great job of putting out, the problems and solutions, but also giving everyone a bit of a laugh and giving us hope. So if I can get your support with the book, I think you'll enjoy it. But I'm also looking to get a voice in the climate dialogue so I can get a voice and help the Lyme community, because the climate is affecting the ticks, it's affecting the toxins. And if we don't geoengineer the Arctic in the next 3 to 5 years, we're going to have a really big problem with sea level rise that's coming a lot quicker than people suspect. So whatever you can do to kind of get on board with this, it's a worthy cause is all I can say.
Yeah, I mean, it sounds very interesting. I myself am definitely a big climate advocate. I hear what you were sharing about some of your patients and their thought process of like, why is it even worth it to build a life? And it's like, it's kind of sad that people are thinking that way. The goal would be to find hope. And,
we can't lose hope. In fact, what's surprising me here is this Thwaites Glacier in West Antarctica. If I'm a doctor and someone comes in with 9 medical problems, but the 9th problem is a melanoma that's about to spread throughout your body, I might want to pay attention to the other 8 medical problems. But the first problem I'm going to put my attention to immediately is, a Mohs procedure and get rid of that melanoma. Well, the melanoma in the climate is the Thwaites Glacier. And we can geoengineer the Arctic. The last time the Philippines volcano erupted in 1991, it cooled the planet by 0.5 degree centigrade by putting sulfates in the atmosphere. We can go into Antarctica with planes at 60,000 feet and put sulfates to block the sunlight to cool down the Arctic, because the permafrost, as it's melting, is releasing methane, which is 30 to 80 times more powerful than carbon dioxide, and it's speeding up the process in a feedback loop. So we've only got a couple of years to do this. And that's why you need everybody to call their senators and get involved with climate groups and educate, because it's going to make not only your Lyme and tick-borne worse and your toxins worse, but, you know, really for the future of humanity, this is the biggest threat we have ever faced. And there are solutions, but we have to get on this immediately. And that's why if the Lyme community could get on board, you know, get the book, buy Starseed Revolution, get me a voice in the climate dialogue. I'm trying to get to Biden. I'm trying to get to Kerry. I'm about to write letters to all our senators and congressmen, like I've done for my last 2 books. Although the last 2 books I actually drove to Washington and gave to them. I'm not sure I'm going to give Starseed Revolution and hand that one out to every member of Congress. I don't think they're going to get this one, but nevertheless, you know, we've all got to think, like, what can we do to save the planet? Like, everyone needs to be part of the solution. It really is an all hands on deck approach that's needed here.
Well, and like you said, it's very clear the link between climate change and a further spread of tick-borne diseases. So, like, there's no reason not to dig deeper into this issue and see how, in addition to other things that we're trying to change for the better for the patient population, how can we, you know, find hope and understand the right things to do for the world as at large.
And, you know, and one of the things that I put in the book that people should know is, when I was looking at the climate grief in 2018, I realized that a lot of these kids are going to need to learn to work with their minds in a good way, right? To not only get over the grief and deal with the anxiety and depression, but also to empower themselves. And one thing I put in the book that most people do not know is, having studied with Tibetan enlightened masters for 40 years, I have put in this book meditation instructions that come from 100 years ago in Tibet, from Khenpo Gongshar. They're very specific instructions on how to work with the mind and actually empower people to make a difference. And there were studies from Harvard University through Benson years ago using quantum physics, that if enough people meditate in a certain specific way, I call this the 1% global climate solution, we can actually work on affecting what I'll call the outside reality from the inside with these quantum physical principles. And the book contains these teachings. They're kind of hidden inside the book, but you'll get the teachings from Master Dorje. So, you know, there's a lot that I layered into the book that's not obvious when you look at the title. But if in my belief, having looked at the science, if I could get 1% of the global population, and there's more than enough with climate grief with that alone, to do these meditation techniques based on the science that has been published through Harvard, I actually believe that we would actually change the outside reality and move things in the right direction. It's a novel solution that nobody has ever come up with, that I realized this meditation technique might actually be useful, but I won't know because it's only been done. They did it during the Israeli-Lebanon war. They did it in Washington, D.C. with these TM City yogic meditators who actually changed social variables in the environment. Nobody's tried doing it on this level. So basically, once the book is out for a couple of months, I'm going to start doing online meditation trainings to make sure people understand the technique. We can do it together, 5 minutes twice a day. I'm trying to bring what I know to the talk and with novel solutions that have really not been discussed so far.
Well, and on the meditation side, is there any benefit to there? It seems like there is benefit to Lyme patients as well, in terms of like increasing your control over your body and other things like that.
Oh, of course. I mean, the Lyme patients in general, the anxiety and depression, right? They have an imbalance of their autonomic nervous system. That's what POTS dysautonomia is, right? So, a lot of times I'll tell people, do the Annie Hopper DNRS technique, get a HeartMath biofeedback, biomonitor. The fact is that the mental and the physical and emotional all work as one. Yeah. So, to get yourself in a calm state, right? Where, it's not just beta, it's alpha, it's theta, it's delta. These deep states of meditation are very healing for the body. They even help your telomeres for longevity. Yeah. They lower cytokines. There's been published scientific research that, Ray, we talked about in the beginning of this talk on dapsone. It's inflammation that makes the Lyme patients be sick. They've shown in these type of meditation techniques, the inflammatory cytokines go down. So there's a lot of reasons why Lyme patients should be meditating. And, and it's beyond religion, right? It's a spiritual technique, but it's a mind-body technique. It doesn't matter what your religious beliefs are. This is independent of it. This will still work, right? Independently. And it could even be integrated into whatever your spiritual beliefs are.
Yeah. Awesome. Well, thank you so much for taking the time, Dr. Horowitz. Starseed Revolution, double dapsone, a lot of great things going on. I'm going to go ahead and let's see.